when a doctor tells you that you've got cancer, it's a gut punch, and it's like, wait, what? You're kind of doing a diagnostic check. Well, I don't feel any different. What? Wait, I can't have cancer. I don't feel anything. How is this possible? Deborah, my wife, wasn't with me. And I'm thinking while he's talking, and you're listening, but I'm thinking, oh my God, she is going to kill me. She's not here. So I'm thinking, there was a part of me for a half a minute who thought, maybe I can, kind of like the old Laurel and Hardy, but the wives need to be none the wiser. I just won't tell her. And just, which of course, as soon as I said it to myself, I thought, well, that's pretty stupid. How are you going to do that? But it is important to have, besides being your own advocate, it's important to have somebody else be your advocate.
Was the PSA something that was helpful in detecting your cancer? And what have you learned about when Black men and all men should get their PSA test?
The PSA was really the first indication that there was an issue. And thank goodness, because it turned out it was a very aggressive form of cancer. We luckily caught early.
And when you talk about something like prostate cancer, which involves having a rectal exam, having blood tests, it's very, very difficult. So sharing what it was really like is really, really empowering. And it helps those of us, the women who have Black men that we love, it helps us be able to say to them, okay, Al did it, now you can do it too.
If we don't all have access to really good healthcare, people are going to die. I think it's as simple as that.
So one of the things we're really trying to do through the Office of Health Equity at Memorial Sloan Kettering Cancer Center is not just raise awareness about disparities like prostate cancer, but also to really advocate so that all people who are at higher risk for different types of cancers can get access to the high quality cancer care that you can get at a comprehensive cancer center, or that you can even get at cancer centers that are part of our public health hospital system.
I think I'd want all men, especially Black men, who, probably, and I don't mean this as a pejorative, but may see going to the doctor, being worried about your health as some sort of weakness, and it's not. I think it's important for us to be very proactive about our health and monitoring it. So I met with Dr. Vincent Ladone, who's the urology surgeon, and Dr. Ladone's staff was terrific. He's got this one nurse, Anne, who's Irish, and she's like a urological leprechaun kind of. And so it was, and the surgical staff at the Josie Robertson Center everybody was just terrific.
Now, how are you doing now? How are you feeling now? And how is it now that you're back at work and, back to your more normal routine?
I feel great. This is the weird thing. I had a shoulder replacement in August, and I'm still dealing with that more than I feel the effects of my prostate surgery.
Beautiful day in Central Park.
I followed you on Twitter and I was watching with amazement as you were walking in Central Park on the bridle path. I think you were there the next day or a couple days later. I'm a very literal person, and
Dr. Ladone said, well, you should get out and we'd by the end of the first week we'd love to. You were walking 5 miles a day, and Deborah said he didn't say all at once, but I'm kind of like I like to kind of push the envelope.
We really appreciate your taking the time to speak with us today about this important topic. And we're cheering for you. We're following you on Twitter, and we're really embracing your journey, and how so thankful that you've inspired so many people, and look forward to seeing you every day on the Today Show.